So our poster today is about our rollout in the service of CBT-T, a treatment for patients who are non-underweight and would like to address their eating disorders. We'd always planned to roll out this treatment, and my supervisor, clinical psychologist Dr. Liz May, had arranged for Dr. Hannah Turner, one of the developers of the treatment, to come and do our training. The pandemic meant that our plans changed slightly, and we then resorted to having the training online and also rolling out the treatment online. So we had a one-day webinar training session, and then we had clinical supervision once a week using Microsoft Teams, which is what we used for all of our team meetings, to help keep our practice on track while we were delivering the treatment. The practitioners who were doing the treatment weren't necessarily CBT therapists, so we had a mixture of mental health support workers, a clinical nurse who's trained in CBT-E, and myself, who is one of the CBT therapists, as well as sort of CBT-E trained. And together we started delivering this treatment, and we rolled it out, and we decided that we wanted to evaluate how that had gone once we'd had a number of people who'd had that experience. And what we found is that actually the treatment not only seemed to work well, which was absolutely lovely, but our effect sizes and our outcomes seem comparable to the face-to-face delivery that's been published so far. So that was brilliant, because one of the things that's a key problem in eating disorders at the moment around the country and the whole of the UK, and I'm pretty sure globally, is that the demand for treatment is rising and the resources that services have to offer are limited. And to have a treatment that we can offer for 10 sessions plus follow-up that can be delivered by novice therapists and be successful has been absolutely fantastic, because this makes us really hopeful that in the future this is something that could be trained to other professionals around the country who might then be able to offer this treatment as well. We found that the training being delivered virtually worked well for us, and so given the current constraints of the pandemic, this is really promising, and we're quite excited about that. So that's why we wanted to share with you the research that we've done so far, or the series evaluation we've done so far, and we hope to continue to monitor the progress in our service as well moving forward.